The basic principles of family medicine include, it is basically committed to the person rather than just to a body, a knowledge, a group of disease or a specific disease, as I already mentioned to you, and seeks to understand the context of the illness, not just in the, pertaining to a particular person, but also to in terms of the family and the context. There is definitely an approach, a difference in approach from other specialities after you learn the principles, and after you try to imbibe the principles of family medicine. I'm sure you will be dealing with your patient in a different way. Then commitment, not terminated by the cure or the end of the treatment. As I told you, he is there from right from the beginning right to the end, and is not just for a person or that person who comes with an illness. That the attachment is towards a whole family, and then the whole family moves on to the community. And family physician views his or her practices as a population at risk, I told you. Next slide. He sees himself or herself as part of the community-wide network, and then ideally family physician should share the same habitat. Yeah. So family medicine doctor or family physician, as you know, it used to be there. Decades ago, this kind of practice used to be there, where the family physician used to see the patient and also used to go to the house, visit their patients. That kind of a concept, as I mentioned earlier, it slowly faded away, but then it has come back again, and the importance of home visits and things has come back, especially as somebody has already mentioned about the during the COVID era. And I'm sure now you may be seeing you must be doing also a lot of home care practices and telemedicines and all those things. The family medicine sees patient in their home or anywhere. Actually, family physician can see patient anywhere. You see him in your clinic, in a hospital, at his workplace, at home, anywhere. And another most important thing is family physician can always be an administrator, because a lot of aspects of medical administration is also being covered in principles of family medicine. So he can also be a hospital administrator, he can be a physician, he can be a friend, a guide, a philosopher, anything. So these are the goals of family medicine training. What we usually, give an orientation in usually during the orientation classes for the DNB and MD classes, the MD program. So the Indian medical graduate is to be given a lifelong career path as family medicine specialist, capable of providing comprehensive healthcare across varied settings from primary to secondary level of his or her practice. As I told you, has kept on stressing that our main idea or main practice lies in the primary care management. That is definite. It's a broad specialty. We are not going into depth of each specialty, but we will be specialist in certain skills pertaining to you can practice family medicine in a rural setup. I'm sure there will be a lot of people who will be doing rural practice and urban practice. This is one specialty which you can, freely do in any of the setups, whether it is hospital or, as I told you, anywhere. The objective is basically to give proper training and hands-on experience to those who are interested in gaining so much of experience in family medicine, or who are interested in primary care management. The objectives basically to educate and train undergraduates, as we've been doing a lot of orientation classes in the medical colleges. We've been trying to bring up or to put the message into the undergraduates and the postgraduates that primary healthcare management is in between. There were a lot of instances where a lot of people were asked to join the the rural areas and all after the MBBS. So, there are a lot of people who are interested. There are not a lot of people who are not interested. For those who are interested in primary care management, definitely this is a very good scope. And the medical expert and the clinical decision maker, he'll be good at as a medical expert and a clinical decision maker. The doctor-patient relation, communication, and the consulting skills can be, improved a lot. He is a good collaborator, a manager, as I told you, between the patient as well as the other specialities or any kind of services pertaining to that particular patient. Suppose a patient who needs physiotherapy or speech therapy, or he needs support from orthopedician, nutrition. The family medicine doctor happens to be the most important point of contact, who can actually collaborate between everything. And that in fact, even from my personal experience, I have noticed that the patient will have so much of trust, and for anything and everything they will ask you your opinion before they go in. Even when they are going to have some kind of a function in their house or marriage, they will take your opinion. It is that kind of relationship what you build up with your patients and your the patients and other people around. He happens to be a health advocate, a long-time learner, and he happens to have a good medical practice and care. And definitely the professional, ethical, and legal obligations would be there. And the family physician always works with the team, as I told you, in different scenarios. The team differs, but then the family physician always turns out to be a patient person and a good collaborator. This is in short about what we usually tell our postgraduate. This is a rotation for our post-graduation courses. I'm just for your information that there will be a foundation course in in family medicine. Then there will be mostly training in both theory and practical in general medicine, surgery, obs-gynae, and pediatrics mainly. Then family practice, emergency practice, and the short postings like the ENT, everything. All the subjects pertaining to family medicine will be covered. And mental health has got a very important role and an important part in terms of family medicine training in the state. So that has got an important, that is something which you don't learn a lot in your undergraduate practice, but this has got a lot of role in family medicine training. So these are the opportunities abroad, like these are the various degrees and their fellowships and all, whatever. I think it holds more important when you're doing a 3 years program, postgraduate program. In terms of fellowship, I must say, can I have the next slide? In India, these are the opportunities. You can run your own clinic. You can be your own boss. You can have group practice. You can work in a polyclinic, secondary level private hospitals, tertiary hospitals, academic institutions. If you are interested in, teaching family medicine, you can do that. Government practices, services where the PHC and the FHC and the CHCs usually adopt doctors who are trained in family medicine. And a lot of states have adopted this. And of course, the NGOs and the central government agencies. So these are the main areas where, you could do your practice once you are trained in family medicine.